Hi, I'm Steve Leonard. I'm very pleased to host this dental masterclass for Forthglade. I think it's really great that they are getting behind dental care in dogs, because this is something that I see on a daily basis, because I'm a practicing veterinarian. I've been practicing for 25 years now, believe it or not. Some of the older people on this meeting may be aware that I was in a television documentary 25 years ago and are now shocked that it's 25 years ago, following me through my veterinary training and into those first years of practice. And even back then, dental disease in dogs was a big issue. It seems that we're more aware nowadays that dogs have teeth, but believe you and me, I knew that for many, many years as a practicing small animal vet. But in my early career, we had very little we could do about it. We've got a much greater understanding on how to look after our pets' teeth now. And that all starts with diet, genetics, breeding, the whole shebang. Plays a big important role on whether your pet is going to suffer with dental disease or not. There are certain things that we as vets do, and people really see, that we say your dog needs a dental. And what do we mean by that? Well, we say, well, they need to have a scale and polish and an assessment. But by that point, things have gone too far. What we really want to do, and where we're really starting to move forward, is prevention of all of that anesthetic and surgical sort of interventions, cleaning under those gums with ultrasonic scalers and extracting painful and rotten teeth. So what I really want to go through is what I talk to clients about every single day. And there's a few real sort of hints and tips to make this achievable for you at home. I know many of you have probably tried this. Some of you have tried and failed, and think that your dog isn't a dog that is one that will accept brushing. Well, I'd like to try and change that myth. I'd like to sort of get people to understand that you can pretty much take any dog towards having its teeth brushed if you go gently enough. And that toothbrushing that people do at home is the thing that will prevent that dog needing as many anesthetics, as many teeth out, bacteria in their bloodstream affecting their liver, their kidneys. All of these things that we know have a serious impacts on your pet's welfare. There's two things you can do to look after your pet at home well. And those two things that we check constantly are their body weight and their dental disease. Okay, so we know this, the staggering statistic that 85% of the dogs that come through the door above the age of 2 have periodontal disease. This is not just your common and golden gingivitis, a little bit of redness of the gums. This is bacteria getting down between the gum and the tooth, down into the bone, and loosening the attachment of those teeth. Now, back when I was, like I say, a fresh new graduate, we didn't have all the technology that we have now available to show people this degree of disease. So we have now dental x-rays that we can see these things. We can see the impact that it has on the bone under the gum, and we can do that under anesthesia, and we can pass probes in there to give you a sense of how far things have gone. When I first qualified as a veterinary surgeon, if I wanted to take a dog's molar out and it has 3 roots, I would have to split the crown, the bit above the gum. Now, we've all been to the dentist. We all know the sound of that dental drill, that high speed wee sound, and it obviously makes some of you, I'm sure, shudder at home. However, they are brilliant bits of kit. And we didn't have them when I first qualified. 25 years ago in Lancashire, we used a junior hacksaw. Okay, so that was, that's how far things have come in the veterinary profession. We've really, really moved on. So what we want to do is we want to prevent us reaching for that drill. And the way to do that is to get our pets used to having their teeth brushed. Now, I'm already seeing some really good questions popping through about the older dog. And I will talk about the older dog a little bit later. I want to start with those young dogs, because let's start from that. You've got a puppy, you've got it home, you've got, a blank canvas. This is what we want to do. So we'll talk about the training, and then I'll bring that up to date for the older dog, because I know many of you, your first introduction to you need to brush your dog's teeth is when they've had a dental or they've been advised that they do need a dental. And you're now talking about an older dog that's maybe a little bit mouth shy because they've got some dental disease, they've got some gum pain, they've got some dental issues that make them shy about having their mouths handled. And it's just such a new thing. So if we take it, right, it's a puppy. Let's go with it's a puppy to start off with. So they have baby teeth. They have baby teeth that erupt pretty soon, you know, in the first few weeks after birth. Those teeth start to emerge, and we've all experienced them. You know, you take your puppy home at 8 weeks and those teeth are like needles. Now, they only last for 6 months. They shed them and their adult teeth come out at 6 months, and those teeth have to last them a lifetime. So what can you do to try and look after them? Well, one of the things is just get your dog used to having its mouth handled. I talk to puppy owners all the time about handling their mouths, handling their ears, playing with their nails, all the things that you're going to have to do as a dog gets older. You don't know if this puppy is going to need dental treatment, ear flushing, nails clipping, and those sorts of things. So just make all of these handling a really gentle experience where they just know, and you know, that they are sort of, you know, non-painful things, that it is completely normal for somebody to stick their finger in their ear and wiggle it and this sort of thing. Imagine a puppy that goes into a household like mine. I've got a 4-year-old child and a 7-year-old child, and I've got a 2-year-old dog. Now, that 2-year-old dog has had its ears pulled, its tongue yanked, its, you know, hair picked up on its back from toddlers from day one. That dog is bomb-proof. Amlam is brilliant. We can do anything with Amlam because she's just so used to that sort of mauling that she gets from the kids. But we've also gently, very, very gently said, right, let's brush your teeth. So you start with the same phrase every single day. You start with, right, we're going to do it in the same place and we're going to do it daily. You say, teeth time. So all of you who get your dogs to sit and wait before you put the food down, you're just going to elongate that process. If you've got a dog that will sit and wait while you have a bowl of food, that dog wants that food. That dog, more than they wants the food, is to please you. Okay, so how do we tell them that we please them? By giving them the food and saying, well done, good girl, good boy. That's the thing. So you're going to do the same thing with your dog, but you're going to go sit, wait, teeth time, and then you're just going to gently handle the outside of the dog's mouth. You're just going to have a quick feel and you go, well done. Tell them they've passed their GCSEs. It's that level of enthusiasm. Good girl, good boy. And they go, oh, that was a bit weird, but didn't hurt, lasted a few seconds, followed by lots of praise and that food reward. And that can be their normal regular food or something that gives them a bit more of a reward, a bit more special. And that's where your dental chews will come in, because they're really useful because the dogs really love them. They do also abrade the teeth, and it takes a bit longer for them to eat. So it's a more of a reward. It's a sustainable sort of thing. So we'll come on to those other things you can do to help keep their teeth strong and their gums healthy as well. So what you want to be doing is then basically slowly increasing that. And the way I talk to people about this, it's like dancing. I'm sure many of you watch the dancing shows on the TV, and no, I've not been asked, and no, I will not be doing it. But imagine being taken into the middle of the floor and told you're going to be doing a tango, and ready, here we go. And somebody tries to tango you around the floor and you've had no lessons. That would be terrifying. It would be terrifying and it would go wrong. And this is where, as vets, we've been a bit slow on the uptake. We've given you, the owner, toothbrush, toothpaste, go home and brush your dog's teeth. And you've gone home and the dog has hated it because you're trying to get them to tango too soon. Teach them step by step. Different people will pick up the tango at different speeds. We've all seen that on telly. There are the Ann Widdecombe's and there are the people that can tango. So what we want you to do is take your dog at the pace it can cope. And as a puppy, it hasn't got any negative associations with tangoing. It's like, oh, this is, you know, if you start early enough, they're like, yeah, that's fine. If it's an older dog, they're going to be suspicious. They're going to be suspicious because this is something it's never experienced before. You may have had this dog 3 years, 4 years, 5 years, 6, 7. You might have had this dog 10 years and never stuck your finger in its mouth. And now you're going, here you go. And they're going to go, whoa, whoa, whoa. This is not what we do. Okay. So gently walk them towards it. You can teach an old dog new tricks, no problem at all. So start slow, do it at the same time each day, and then just teach them a new step only when they've mastered the last step. Where your dog is learning is where they're looking at you and going, this is a bit weird. So your dog's sitting there and you're going, right, I'm just going to stick my finger in your mouth and rub your teeth. And the dog's going, hang on, this, you've not done that before. That sort of slight concern and looking is a dog going, is this okay? Is this okay? Or do I need to do something about this? If you push them so far that they go, gaff, 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 they're not learning. A dog that is escaping. So you back off a step. So the steps that you need to walk through are getting them used to having the outside of their mouth handled. Well, the step before that is the one hopefully most of you mastered, which is sit still for a short period of time. Start with 5 seconds. Sit, wait, 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 wait. Well done. Then 10 seconds, then 20 seconds, then 30 seconds. And once they've really nailed, oh, you need me to sit still, then you push them to, I need you to sit still while I just lift your lip up and have a look. And they go, oh, hang on. And you go, it's all right. That's all. And you just go lift. And if they move ever so, you just go, it's okay. And you stop at that point. And you stay at that point for the next week. You might stay at that point for a month with a really shy dog around its mouth, but you stay at that point until they're going, oh yeah, it's this. Yeah, there you go. And then your dog's going, okay, done. They're ready to go to the next step. The next step is a little bit of toothpaste on your finger, still your finger. Dogs are really, really amazing with how they totally get whether it's a finger or it's an instrument. If many of you have had your dog's ears looked at or trying to use eardrops, they're absolutely happy for you to poke in around their ear with your finger. As soon as you get a bottle, they go, what's that? What's that? I know that's not your finger. So that transition between finger and the next training aid, which may be a thimble brush. You'll have all seen these on the video where they're a rubber thimble with bristles, these rubbery bristles. Now, bear in mind, those are training aids. They are not the actual brush, because you need the fine bristles of a brush to get into the tooth gingival margin, that little tiny little gap between the gum and the tooth. You need the fine bristles of a toothbrush. Those rubber bristles are only there to get them used to the change in sensation. So you basically get that in there. Now, so when you move from, you may have got to the point where you can literally poke your finger all around the mouth and they go, I'm fine with finger. You put that rubber thimble brush on, or you move from the thimble brush to the toothbrush, don't expect the same level of acceptance. That's a big step. So go back to touch, 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 stop. Then the next day, slight rub, slight rub, slight rub. Or the next week, slight rub. Always move to the next step once they've accepted that step. And always, always lots of fuss, reward. Here you go, you got your dental stick. They want to know that they've done the right thing. So let's flip it back to the old way of doing things. And now we think about this dance, okay? So what people have probably experienced at home, and I know many of you will have tried this, is to try and get a dog to accept something, is let's think about the dog's experience, okay? That experience that we just talked about, the really positive and slow experiences, the dog goes, oh, yes, it's this, okay? It's school time, I'm gonna get a reward, and they're sitting there almost vibrating with excitement because something's happening. And you're having fun because you two are doing something together, and you're learning together, and it's a new skill, and somebody comes around and you go, watch this, sit, wait, okay, yeah, go on, let me, yeah, look. And you say, see how far I've got. Imagine you're showing a friend who come around and say, look what Tiger can do today, bam, 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 bam. And you go, look, isn't he good? That dog is going, I am good, I am good, I am good. Because they know that you're really happy about this. Now, flip back to the old system, okay? You've been given that toothbrush, you've been given that toothpaste, you've gone home and you've gone, no, sit. Why aren't you, just sit, that's a very, very different experience. The dog is really, really stressed because it doesn't know what you want. You're getting frustrated. You're starting to growl by going, they really, really pick up on you. So if you're finding yourself frustrated, you need to train yourself. This is a dance you're learning together. This is something that you're working towards. And I know that that's that, oh no, the vet's told me I've got to brush his teeth. So how am I going to brush his teeth? It's about taking it slowly. I would rather you took 3, 4, 5 months before you could brush your dog's teeth. If it takes 5 months, it takes 5 months. But if at the end of that 5 months, you can do, and you will do it every single day because it's something they enjoy, something you enjoy, and it's something that you can fit into 30 to 60 seconds a day, that will, for the rest of the dog's life, that's worth that investment. It's worth waiting that bit of time, even though that you want to crack on and be able to do this. You're going to be doing this daily for the rest of the dog's life if you're going to do the best you can by your dog's teeth. So it's really, really important. So those older dogs that are mouth shy, so those of you who've suddenly realized, oh my gosh, I've been for the booster, there's tartar everywhere, the vet's told me he needs a dental. So they go in, they have the scale and polish, and they're told, right, here you go, you need to start brushing your dog's teeth. Don't panic. Take 6 months, take a year, but just take it slowly. Key points are, do it once daily. So this becomes a normal, everyday experience. If you're trying to do it once a week, it's not frequent enough, to keep the plaque bacteria under control. 24 hours it takes for bacteria to use up the oxygen in the gum margin. So you've got the aerobic bacteria, which are the good bacteria. They're burning up the oxygen and they're covered in a biofilm. So this film that stops any more oxygen coming in. And over that time, those bacteria are working away in that gum margin and they use up all the oxygen. Then they die. And what grows is the anaerobic bad bacteria. So what you're doing after 24 hours is you're bringing that brush in, and it's not the toothpaste that's doing all of the work. Toothpaste helps, but it's actually the brush that just goes boom, and it takes that biofilm out, and you introduce oxygen, and those healthy aerobic bacteria go bing, we're back again, we're going to look after this mouth for you. So that's why you have to do it daily. You're not brushing food away, you're brushing that biofilm and introducing oxygen so you can feed your pet afterwards. And that's a really key thing, is they need that reward. They need to be told they've done the right thing. And this is where some high value and beneficial treat. And this is where these sort of Forthglade dental sticks, it's great that they've put these together now because they satisfy that really well. You watch a dog chew one of those things, it's getting it in right in the back of their mouth, and they're working away in it. This has a number of benefits. One is that it's using the teeth for what they're intended to. So instead of the normal kibbles and those sorts of things that have a little bit of crunch to it, they are actually building. The more force you put through the bone, the stronger the bone is. So by just literally chewing, you will get a better strength of bone around those teeth. However, never allow your dog to chew something that is stronger than its teeth. So deer antlers, bones, really hard plastic chews. People pick them because they think, the dog, you give them something soft on that and it disappears in seconds. It should break. That's what chewing is for, is to break food down. So a dentist is ideal because it will break down but apply a decent amount of gentle force to those teeth. Okay, so we see lots of fractured teeth from bones from especially deer antler. Deer antler is stronger than teeth. So if a dog really gets it between its teeth and puts a massive amount of pressure in, it can break the slab fractures of those teeth, and then they require extractions, which is obviously the opposite of what you were intending. So a high value treat. The other thing about compared to, you've seen how fast your dogs hoover up things that they like, a little morsel of a treat, is you give them a little, square of dog food or a little bit of dried liver or something along those lines. It's gone in seconds. There's no long reward. And that's where something like a dental chew, where they'll work on it for, some of them I know will inhale it in a minute, but that's fine. Some dogs will take 2 or 3 minutes, but that's a really good length of time for a dog to have some food and some reward. So that's really, really important. So doing daily, always followed by a very huge amount of praise. These guys have passed their exams. That's what you want to be. Well done, you're great. And think of it very much as if you were trying to show off your dog's trick to a friend. Basically, it's like, look what he can do, because they pick up on that tone of voice that you're using, that they're saying, we're doing this together. This is great, isn't it? And my own dog, Amlam, she loves it. She thinks it's all part of grooming and fuss. And that's what it should feel like to them. It just should feel like having their hair brushed. It's that same thing. Now, use a palatable toothpaste. That's another really important thing. Dogs don't spit. So like babies, like children, they can't have fluoride in their toothpaste. So they need a doggy toothpaste. So doggy toothpastes are, they're non-fluoride, so they can swallow it. It's safe to do that. They don't like frothing. Frothing has no benefit at all. We like frothing. Toothpaste manufacturers put frothing agents in toothpaste, and it has no effect on our teeth whatsoever. We just like the sensation of it. And that's what we're used to. So it's got to be a mildly abrasive paste that is safe for dogs to eat and is part of the reward. So if it's slightly meat flavored, so most of them are chicken or fish flavored and this sort of thing. If your dog doesn't like the taste of the toothpaste, then use something else, and you can literally just use water, or you can crumble some of their kibble and just flavor it with food, because you're not brushing food away. It is literally that mechanical brushing of that biofilm to open up that area for oxygen to penetrate. So that's what you've got to use. So use an appropriate lubricant, so toothpaste. And the key thing is, like I say, is that daily treatment. And if you do it right, and the final thing to say in these points is you're brushing their tooth gum, you're brushing their gum margin. The bit of the tooth at the top, this doesn't need as much brushing as the gum margin. This is where you're trying to get in there. Now, one of the things that I commonly hear from people is they start brushing, they've never brushed the dog's teeth, they start brushing and the gums bleed, and then they stop because they're worried that they have hurt their pet or it's doing some damage. The complete opposite is true. What's happening when they bleed is those gums are inflamed already, but anaerobic bacteria are down the side of the gum. They're causing a problem, they're causing inflammation, and you're rubbing your brush through there, you're wiping into that area, and you're causing that sensitive inflamed gum to bleed. You brush that same spot 3 or 4 times on the bounce, like days on the go, you will completely reverse that gingivitis. You will eliminate that gingivitis. So it's really, really important that if you see a bleeding spot, actually brush it. Now, many of you will have been brushing your own teeth and spat out and gone, oh, where's that blood come from? There is no sensation with brushing gingivitis, okay? Bleeding gums don't hurt. It's the periodontitis. It's when the bacteria get worse and down into the bone that's holding the tooth in place under that gum margin. So it's really, really important that you continue to brush if you see bleeding. If you see excessive bleeding and it's not resolving, you do need to speak to your vets, and they will check those, because there are certain conditions that can cause excessive gum bleeding, excessive gum inflammation, that you may need to speak to your vet about. And then finally, just pick a appropriate toothbrush. There are all sorts of fancy toothbrushes with sides that that come in from 2 sides. Don't tend to use those, because as you go over the top of the crown, those 2 sides don't get down to the gum margins. 45 degrees down towards the gum margins on the lowers, 45 degrees on the upper. And you don't need to pull your dog's mouth open to see what you're doing. Poke the toothbrush down the side as you would yours, and just feel your way. You should be able to feel the bristles running alongside inside the cheek, just nice and gently in little circles along that tooth gum margin. That's what you're trying to do. So I know I've noticed that it popped up. Somebody was saying on a question, my dog chews the toothbrush. There's a couple of tips for that. One is gently hold your dog's mouth shut. Okay, so you literally just hold over the snout and you poke the toothbrush in, and you get them used to having their mouth held first. So if this is something new, just again, hold it for a couple of seconds, well done, touch, hold, touch, well done, hold it a bit longer, brush, well done. Build it up slowly, and they will get used to the fact that you're just going to gently restrain the nose. You're doing so well. And that confidence, oh, look at you, well done. That's it, way to go. All that sort of stuff, all those little feedbacks that they're doing well, and you're really pleased with them. And, you know, you can almost feel them. They want to move, but they want to sit still. You know, you're rewarding that really good behavior of letting them do it. And if they're wriggling too much, then you just stop and you go, no, wait. And you go back a step. You keep going back a step. So one of the last things, because again, I was going to say there's two ways for if they chew the toothbrush. One of my vets gets a big rubber ball, and the dog holds the rubber ball in its mouth, and they're trained to hold. So Alfie, a wonderful staffy owned by Amy, one of the vets I work with, she just holds that. She actually uses an electric toothbrush and goes around all the sides of his mouth. Most of you will struggle to get onto the inside. So if by holding the mouth shut, if you only brush the outside, 90% of the dental disease that you see in dogs is on the outside. Only 10% is on the inside. So if you only brush the outside of their teeth, then you will find that you'll get 90% of the problem. So start with that, and really brushing the inside is very advanced. And again, you can do it, but you do need them to hold something like a rubber ball. So wow, I can talk about this all day, because this is something I see the ramifications of getting it wrong. So what I'm going to do is I'm going to throw it open to any more questions now. Let's have a look. I'll see there's loads in the chat here, so I'm just going to throw this up. So, and other people's electric toothbrush, wow, impressive. Yeah, it is. That's yeah, from Rebecca. Children's gentle toothbrush is okay to use. That is true, Rebecca. So you're looking for an appropriate sized head. So most children's toothbrushes, the bristles are softer. So start with those, and they're actually generally where you'll stop. You don't need to use anything more robust than that. A children's toothbrush. Now, Joe's just popped in and said her dog is Aldi and found chewing hard. What can I do for care for her teeth? This is where, if you've got any indication that there may be some discomfort, it's really hard to tell if your dog has got dental pain. Okay, this is one of the big problems we have, is convincing people your dog needs a dental, because you can see that there's tooth root exposure, you can see there's dental disease, and they say, well, they eat fine. So do you. If you have toothache, if you have toothache, you still eat, because if you don't eat, you die. What you do is you eat round it, and it gets so bad in some dogs' mouths that they stop chewing altogether and they just swallow their food. So, Joe, I would say look towards having a dental exam by the vet. It is going to require an anaesthetic. We anaesthetize dogs who are 17 years of age to sort their teeth out. As your dog gets older, and you worry about the anaesthetics, the problem being is if you don't get in early, their pain will get worse and worse, and more teeth will get infected, and then they'll need a really long anaesthetic and a lot of dental surgery at an older age. Get in early, get it solved quickly, and then start the training to brush. And then hopefully you won't completely exclude the need for some scaling and polishing. We all need that. I brush my teeth twice a day, still get a bit of a clean every 6 months or so. Somebody said, Eleanor says that she uses Primula cheese while brushing it to get her dog's teeth cleaned. Is this okay to do? It is, yeah. So if Primula cheese is what it takes, as long as you're not using masses of it and your dog is the appropriate weight, then that's fine. If that's what they really go for, because as I said, it's really there as a lubricant and as a reward. So adopted dog. So Joanna has got adopted dog. Took time, but is working slowly. Well done, Joanna. That is really, really important. It's a long-term goal. Okay. Rebecca said the same thing. It is literally, it's a slow thing. It's saying it took her over a month just to get her to touch his teeth. When you start getting to that point because that first hurdle can seem the longest, but once you get them to the point where they trust you that nothing is going to hurt, nothing you're going to do is going to hurt them, and it's always going to be lots of praise and lots of fuss, those next steps become faster and faster and faster, because it's the first hurdle is, trust me, I'm not going to do anything that you're not going to be able to cope with. Yeah, yeah. So there's lots of other people. So now, B has said, how do you help an older dog feel comfortable with teeth brushing? She's 16. Is it too late now? It's not. It's not too late. You may not be able to brush all of her teeth, but even the ones at the front, just start super, super gentle. This is, you want to start thinking of this as very much, it's about fuss. This is about quality time with your dog. If you're finding yourself frustrated, it's not going to work. If your dog is frustrated and trying to escape, it's not quality time. Even if you just go for the first month and go, B, I'm just going to be with my dog and I'm just going to stroke your muzzle. I'm just going to sit there and stroke your muzzle and go, I love you. You're 16, you're gorgeous, and I love you. And that's all you do, and talk to them in that way, as you do already, and then go, let me have a little, let me have a look. And that's all you're going to do. That's all you do. And they go, that's a bit weird. And then you go, look at this, look at this. Then here you go. Look what I bought, some Forthglade dog chews. Buff, have one for being such a good girl. And that's what you do. You just, and they go, rum, rum, rum. How do I get another one of those? Now, the final thing to mention, okay, it's really, really important that if you're going to use a high value treat like a dentist stick, that's food. When we've got a lot of people who've got dogs who are carrying excess weight, it's really, really important that if you add in something to the food, you take something out of their daily ration. Okay, it's really important. These things have calories. That's why they're a reward. They're a really good way of rewarding dog because it slows them down. Slow eating also helps increase that sense of being full. So you can use these dentist sticks to reduce the dog's ration, total calorie ration as well. So if you've got an overweight dog with dental issues, or you want to prevent, still use these dental chews because they'll allow you to, so you can feed, they might hoover up their normal food, but then when they need something slower, and if a dog eats something slowly, it feels fuller because food has hit the stomach before they've finished. Try it yourself. If you're worried about eating too much, eat slowly. If you eat slowly, you will be able to eat smaller portions because your body is already starting to absorb some of that glucose, and that makes you feel, oh yes, I've had something before you finished. So that's the other reason to be using some of these high value treats. Look, I'm hoping that some of you got some really good things out of this. I think we've got a few more minutes. If anybody else has got any other questions, I'm just going to slip through here. So just, can you, if anybody is out there, is anybody actually brushing their dog's teeth now? So if you can just either give me a thumbs up or type a message and say, and if you are, can you tell me how long it took you before, whether they're a puppy or whether they're an older dog, how long it took you to get them to the point where you can brush them? And while you do that, so Catherine Lamb, well done, she brushes her dog's teeth. She's also said she uses the oral care gel every day for my dogs. Do you think these are worth it? If you cannot brush your dog's teeth, and if it is, they are just so shy and it's taking a long time, then using something to help break that tartar off. The dentist sticks will do that. So those dental chews will actually break some of the tartar off. So they can be useful for that. The gels and rinses, chlorhexidine, so they're similar to mouthwashes in people, they can reduce the bacterial burden of those anaerobic bacteria in the mouth as well. They're not a substitute. There is no substitute. It's a bit like going to, if you go to the dentist and say, I chew chewing gum, do I need to brush my teeth? They're going to tell you need to brush your teeth, because there is, unfortunately, we yet don't have a technology, and their anatomy is the same as ours, any better than the fine bristles of a toothbrush to get into that sulcus, to clean out that biofilm, to introduce oxygen. So all those other things, think of them as very much as add-ons. It's brushing that you really need to do to prevent dental disease. And to give you an idea, I know 2 humans who've had heart valve replacements from not brushing their dog's teeth, their own teeth, sorry. They got significant enough bacterial infections in their mouth to spread to their heart valves. Okay, so that's the ramifications. All these dogs with rotten teeth, every time they chew, they're literally pushing bacteria into their bloodstream, and that bacteria is going everywhere. It's going to kidneys, it's going to liver, it's having a serious impact in their quality of life. And one of the most satisfying things to do as a vet is deal with those teeth. Some of these older dogs, and I have done dentals that have taken 4 to 5 hours to take out rotten teeth in older dogs, and spent a lot of clients' money, because I know, and as many of you do know, a lot of this dental work is not covered under insurance, and that's because it is so common. To keep your premiums down, the insurance companies don't cover it. But although people have spent over £1,000 for me to sort their dog's teeth out, they tell me it's made a massive difference. It's made a huge difference. And they say it was the best thing they did, because their dogs turned back to puppies because they had chronic pain. They had serious chronic pain that they couldn't tell their owners about. So I want to prevent those. I don't want to sit down and take dogs' teeth out. That's not what I want to do. I want to reach out to as many people. And this is why I'm really pleased that Forthglade have got involved behind this, because as pet food manufacturers, they can have a big reach, and they can let people know that it is preventable. All right, so here we have had a few people. Yeah, so Joanna Harris is starting the brushing process. That's great. Joanna is doing it once a week. He's 6 and is always used to having his eyes, mouth, and hand mouth, eyes, and ears handled. Now, yeah, daily. I'm afraid I know it sounds like a big commitment, but I'm talking about 60 seconds. 60 seconds a day to brush their teeth. That's how long you should be spending on doing it. If it's taking you half an hour, you're doing it wrong. Okay. Yeah, so people have been brushing. So Catherine's been brushing since they were puppies, and they're 9 and 6, and the vet is always shocked at how good their teeth is. And I will contest that. I will say that's, no, I won't contest that. I will agree wholeheartedly. I'm seeing 13-year-old dogs who have got teeth that look like puppies' teeth, brand new teeth. And I'm going, I don't even ask them if they brush. I say, you brush, don't you? Because we see it. We see it on their annual checkups. We lift up those gums and we go, wow, yeah, they make a massive, massive difference. Vic has said, can you go back over the inside of their teeth? Do they need brushing? So yeah, again, going back to that, that's harder to do, Vic. It can be done, but you do need to get them to accept holding something in their mouth. So a large rubber ball that just wedges behind those canine teeth can allow you, and it's, again, starts super, super slow. So literally just dab, dab. Don't put your fingers in between those molar teeth at the back. They are like secateurs. They may not intend to, but they can bite your finger off by accident. All right. So Jade is saying hers is 2. We only just started recently brushing her teeth. However, we do it. We groom her, not every day, and it's a bit of a wrestle. Right. Again, perfect. She's come back with, we'll use your advice to do daily and slowly. Perfect, Jade. She's 2. You might be doing this for 14, 15 more years. So just make it easy. Take 6 months to learn how to do it gently. Brilliant. This has been really useful, hopefully, for me, because I'm starting to see, you know, some of the issues that you're having and this sort of thing. I hope you found it useful. It's probably the thing that I'm most passionate about in educating people about, because it's something we see every single day. It's something that has a massive impact. And like I say, you know, I don't mind doing dentals to fix them, but I'd far, far better lift up those lips and look at those teeth and go, there's nothing for me to do. That's what I want to see. Thank you for your kind comments. First class mascot, Mark. Thank you very much. That's yeah. Look, this is bread and butter stuff for me. I do it every day. I talk to people. It's really nice to talk to a group of it. I wish I could have seen you all. I'm sure you're all hiding there in the background in the ether. But look, to take your time. You obviously passionate people about your pets to log on and listen to me rattle on about this. So I know that you know, with a bit of motivation and a bit of training. Now, do go and look at this is recorded. It's, you know, if you want to send it on to your other sort of doggy friends and this sort of thing, then the more people we can get doing this, more people we can influence to try and get them to look after their pet's teeth. That's great. So point them towards the Forthglade website. There's going to be a load more information on there. Yeah, just good luck with all the brushing.